Today, I am here with Dr. Maria Elena Ruiz, who is an infectious disease physician at George Washington University Hospital. Along with her career as an infectious disease physician, she's also spent a little less than 2 decades as a clinician educator. Thank you so much for being here.
It's my pleasure to be here, Pallavi.
Of course. So my first question for you is, why did you go into medicine, and why did you specifically choose to be an infectious disease physician?
Sure. My father was a physician, and I think that was a big influence on me. But I think what influenced me the most was one time when there was a neighborhood kid that was sick. My father visited him at home, and I saw the relief on his mother's face, on the kid's face, and the mother, when my dad was able to tell them what was wrong and tell them that it was going to be okay. And I think that really had a big impact on me, showing me how physicians can help people, not just in treating them, but in giving them hope, and explaining to them what is happening.
Yeah.
So that was one of my big motivators. Most of my life, I wanted to be a psychiatrist, actually. So since I was a child, so I have a BA in psychology, and a lot of my focus in medical school and in undergrad was getting experiences in counseling. But when I was in residency, I changed to do internal medicine, and in that process, again, I wasn't sure what I was going to do, but then I rotated at NIH, and the physicians there really inspired me. I think that is one thing that I always tell people, is that you'll find your tribe. Like, you'll meet someone that you really look up to and that is so similar to you that you'll see yourself in them, and they'll see themselves in you, and so they'll mentor you. So when I rotated at NIH, I worked with Dr. Steve Holland, and I also had the privilege of rounding with Dr. Fauci.
Wow.
And that was really a formative experience. And what I saw, what they did, I decided that that's what I wanted to do. It was a little late in my residency. It was third year. Most people decide what they want to do second year, but that's okay. And that's something I tell people all the time that want to do medicine is, you may think you have a path and an interest, and that's great. But in the process of becoming a doctor and training, there may be other things that you'll see that you didn't realize you were interested in.
Wow. And so can you describe your job a little bit? Like, what does an infectious disease physician do day to day?
Sure. So to describe my day to day, I think I'll have to tell you what I do. So infectious diseases clinicians are clinicians, so they spend a lot of time with patients. And because our job is more cognitive, we're not in the operating room so much or doing procedures, a lot of times we are the people that do a lot of education and also do administrative duties in a hospital or a clinic. And so what I would say I do is, most of my time is spent with patients. I see them in the clinic and in the hospital. A good portion of my time I am also teaching residents and students, and so they come to my clinic to observe and to learn, and they also round with me in the hospital. The other part of it is research. And so I do mostly clinical research, and that has not been a big part of my job. I've done a lot of research oversight as IRB chair at my prior institution, and also I worked at the FDA for a year.
Okay.
So I learned a little bit about drug approval and research. But in my job, what we do is offer patients clinical trials, maybe for medications, and also in terms of the education, allowing the residents to get experience in research. And then the last part is the administrative portion, which right now I'm the hospital epidemiologist at GW. And so that job is sort of making sure that patients are safe, that we follow our policies. If there's someone with an infection, where do we put them?
Yeah.
If there's a new outbreak like monkeypox, is there anything that we have to think about in the emergency room in different places?
Wow.
So that is what I do. My day-to-day, I would say the beginning of my day, depending on what I'm doing, is I usually check my email like everyone. A lot of times I get questions from other doctors asking me advice on, what to do, for instance, in the operating room in terms of an infection. Or the hospital reach out to me with a specific case that I have to review to try to understand what happened. Then what I do is I check messages from my patients and respond. We have an electronic chart. I'll do refills. And then I usually go see patients. When I'm in the hospital, I spend the whole day just seeing patients, working with residents. And then when I'm not on call at the hospital, I do clinic, and I usually have a half day of clinic, so on a day. So the morning I'll review charts, reach out to patients, call them with their results, and then I would say the end of my day is usually studying or reading. I usually will find, and I try to make it that way. I usually will have like a question or something will happen with my patients, and I'll try to read like what is the best treatment. Have there been cases of this before? Kind of keeping up with infections that are happening. So I try to do that the end of my day. Now that doesn't always happen. So when it doesn't, I start my day with trying to read something or learn something.
Wow, it's like you do everything in one day.
So I try. It's a busy day.
Yeah. And so what things about your work and work life do you love so much? Like, what are the daily joys and what kind of drives your career?
Sure. I would say the daily joy is really being with patients. The days can be long, but when I'm with the patients, it never feels like a long time. In fact, it feels like I don't have enough time. And so one of the things that I really enjoy about my job is how active it is. I never feel bored. I'm always thinking. I'm always stimulated. And so I'd say the reward is the interaction with patients, being able to help them, being able to figure out what is wrong. And, what drives me, I would say, is a desire to help them and also to learn. I think one of the things about being a clinician educator is you're surrounded with people that are learning, they're enthusiastic, that maybe bring new knowledge to you that you didn't know. And so I'm always challenged to teach, but also to learn. And that is, I think, the big driver. Like one of the things I love about my job is the continued growth. Like I never feel like I know enough or like I'm going to stop. This is, there's always a new infection, a new antibiotic, a new medicine. And so I'm always growing and I really enjoy that.
Yeah. And so on the other hand, what are some like frustrations or stresses that you kind of encounter in your work?
So one of the stresses I think is managing the time. Sometimes if someone calls me and I have to make the decision of like, okay, I have 2 calls. I only have this much time. I know this person's going to take a long time, but this problem is more important. So kind of triaging the calls and the time can be a little stressful because I feel a little bit guilty if I don't address it right away. And with time I've learned like, no, kind of like how I schedule my day. I'm like, tomorrow morning is the day. Tomorrow is when I'll call the patients in the morning. Tonight, if there's anything emergent, I'll do it right now, but that's for tomorrow. I think the time of it or feeling like you're not there or not doing enough for the patients can be frustrating. I think the other frustrating part is some of the administrative tasks with insurance, like getting like when the insurance won't cover the medicine or you have to do, like get a CAT scan, let's say, and the insurance won't pay and you have to write a letter. Thankfully, like, at least in my profession and in my work experience, we have like support staff that will do that. And also I think because with infections and the type of work that I do, usually that's not so much of an issue, but that is frustrating when like my patient can't get what they want.
Yeah.
Or what they need, I should say.
Yeah. And so I understand that you're an attending physician at the George Washington University Hospital, which means you teach and you mentor residents, medical students, and fellows. What motivated you to teach and mentor, and what is so fulfilling about it?
Sure. So I think one of the things about medicine is that it's really a family, a society. Like you really cannot be a doctor in isolation. Part of the training of becoming a doctor is other people have to mentor you.
Yeah.
And I think we all recognize that. And in the same way that people mentored me and nurtured me and taught me, I want to do that for someone else. I know that the residents are sort of the future. They're going to be my future doctors when I need a doctor. And I also think that in teaching, you learn. So it's almost like I get a lot out of it as much as I am giving. And I think, I couldn't have gotten to where I am without the support of many people who are ahead of me, who are wise, who counseled me, who saw something in me and said, have you thought about, doing infectious diseases or doing medicine? And so I'm doing the same thing for other people. And it's really rewarding, honestly. As much as I do it for them, I do it for me too, because to see a person that's intelligent and motivated and would make a great infectious diseases physician, when I find that person, it makes me happy. And I'm hoping that I'll kind of have another colleague to work with.
Yeah. And so I know COVID-19 really changed a lot of things, especially in the infectious disease realm. How has the pandemic changed the way you practice medicine, or in general just the perspective people have on infectious disease?
Sure. I think the easiest part is the perspective. I think before COVID, I think there was respect for infectious diseases physician, but almost like a lot of people thought like, oh, well, I can do this to other doctors, right? They're like, I understand, I can give antibiotics. I think when the pandemic happened, people realize sort of the value of what we do in helping, like with isolation policies, the treatment of patients. I think it really earned us a lot of respect and understanding of what we do. I think how it changed the work during COVID, I mean, I think one thing that was really good for us in some ways is that we were always front line, so we were never remote because we couldn't be.
Yeah.
So it didn't change in that sense, but I think one thing that it allowed us to do was recognize the power of telemedicine for some patients. And also during the pandemic, I think because of the isolation, because of everything that was happening, I felt like there was a distance between me and the patient with the mask and and I think that it really made me appreciate how much of I need more contact with my patient. I need more like for them to see me and me to see them really well. When we were examining patients during COVID with the machines that were doing the air circulation, it was so loud, patients could hardly hear us.
Yeah.
And so it was difficult sometimes to have extended discussions. We did, but I think it's made me appreciate and kind of go back actually to the way we used to practice. I think what has changed a lot is also, or what has changed for me is also recognizing that there may be other infections that are coming. And so maybe I'm a little bit on the lookout or worried that there might be something else coming. But I think it was, it was a time of growth for us as a field. I think it also showed me maybe that when there's a lot of rapidly evolving knowledge, sometimes there can be data that's not fully reviewed. And so in the COVID treatment protocols, we changed a lot. We thought a medicine would work and it didn't. And, we tried many different things, but it was also really inspiring to see how physicians, countries, research groups were sharing information rapidly to try to help patients.
Yeah. And so I know that when you went into infectious disease, like that wasn't your first initial plan. Were there any other expectations that you originally had going into medical school that were far from reality now?
Yeah, I don't think I realized how much of being a doctor is sort of a collective endeavor, how much you work with other people.
Yeah.
I think I imagined you become a doctor, you know what you're doing, and you'll be like in your office working with people, and you'll be kind of not alone, but sort of like independent, right? But I think, the beauty of the practice of medicine is actually working with other physicians to make your patient better, collaboration in terms of knowledge, research, lots of different things. So I don't think I realized how much time I would spend discussing cases with other doctors. One thing I always say is the type of work that I do, my focus in infectious diseases is transplant and device infections. And so I would have never imagined that I would spend so much time talking to cardiologists and orthopedists and surgeons in my career. But those have become sort of like some of my closest friends just because of the work that we do. And so that was surprising to me. I think the other thing that sometimes can be surprising is that I think when I started my career, I thought okay, there's a very clear path forward, and you just keep rising, and then you'll be boss. But it's not so much that. There's so many different paths, and I think also to get to that top level, you need mentoring. And I think as a woman, sometimes that mentoring is not there, and it's something that I think I was a little surprised that you kind of have to create your own opportunity someone. And so I'm very mindful at this sort of mid-career level to ensure that people that are coming after me have those opportunities and that mentorship.
Yeah. And so you shared already so much wisdom in this short time, but what is one key piece of advice you'd give somebody who wants to be where you are today?
Sure. I would say, as interesting as it sounds or contradictory, I would say take your time. Becoming a physician is a process, and it's a long process. And who you are now is not who you're going to be 8 years from now when you finish med school, or even 12 years from now when you finish your training, depending on how long it is, right? It's a long process. And I think you'll change as a person, and you have to enjoy sort of the process. And so people always say, like, oh, what should I study? Anything you want, really. Any knowledge you have is going to help you relate to the patient better, whether it's like history or literature or music. You're going to have patients, and they're not like one-dimensional, right? There may be things that are really important to them, sports or music or their career or their cognition, because they're writers, right? And for you to kind of be able to relate and understand them is going to make you a better doctor. And I think the more life experience you have, also the more you can relate to patients at different stages. I think that one of the things that was really surprising to me is, although in my upbringing, maybe I had a very sheltered upbringing, the process of becoming a doctor has opened me to so many life experiences, other people's life experiences, that it's very hard to be judgmental or to even have like, I would say really like, I don't know how to explain it, like really conservative, like fixed, like this is the only way to live a life is this way.
Yeah.
This is like, you have to do this. And so I've enjoyed the process of becoming a more open person. And I think it is impossible not to change in the process of becoming a physician. And then the other thing I would say is that, you know, because the work is hard, because the process is long and it involves sort of becoming another person or growing as a person, the people that do it with you will understand you in a way sometimes that other people can't. And so also the richness of my relationship with other physicians and colleagues has been really rewarding, you know, in my life.
Wow. That's really amazing to hear, and about all the growth that you've been able to receive. Thank you so much for sitting here and talking with me. I've learned so much and wouldn't want to have done it with anybody else. Thank you.
Thank you. It was my pleasure to be here, and I hope that some of the people listening will be more interested in infectious diseases and hearing more about it, or maybe even choosing it as a career.